Good evening, good evening. It is 6:43 and it's time for the nation's business. Thank you for joining us. I'm Chevon Campbell.
And my name is Sanjay Lewis. So, the Ministry of Health's Know Your Numbers initiative has fallen short of its target, screening less than half its initial expected individuals. Portfolio Minister Dr. Christopher Tufton gave an update on the program in the House of Representatives on Tuesday.
Just to give an update on the implementation of the program, Mr. Speaker. As of November 2024, the Know Your Numbers initiative has conducted some 220,639 screenings, representing about 44% of what was originally targeted. Performance has varied across the regional health authorities. The Northeast Regional Health Authority has achieved some 83% of its target, while Southeast Regional Health was about 20% or so.
That's Dr. Christopher Tufton, the Minister of Health and Wellness. The Know Your Numbers Healthy Lifestyle Initiative was launched in May 2023. The initiative emphasizes awareness of the key health metrics, including cholesterol, blood pressure, blood sugar, and body mass index. It aims to conduct 500,000 screening tests. Dr. Tufton says there was a gender gap between those who were willing to get tested, and he joins us now to discuss further. Good evening, Dr. Tufton.
Hi, good evening.
First off the bat, Dr. Tufton, I understand that there was a concern about the wording used in terms of us suggesting that less than half the amount was covered.
Well, not a concern per se, except that I think the editorial judgment exercised by your newsroom really missed the substantive issues that were raised in the parliamentary statement by emphasizing the 44%. And I did address that in the parliament when it was asked by the opposition leader. Clearly, I don't have the right to dictate your editorial judgment, but I think the more substantive issues, as carried by others, was the findings of the screenings, which showed that too many Jamaicans are affected by abnormal measurements in their key screening tests, which is cholesterol, blood sugar, body mass index, and blood pressure, and that there are measures that are going to have to be put in place. Some I announced in the conversation, which will hopefully provide greater levels of outreach to get more people to screen, because screening actually helps in terms of prevention. It encourages people to understand what their numbers look like and then hopefully take collective action. So it's a new program. I did say in the parliament that I have not complained too much to the people who were implementing this logistic exercise across the country based on the 44%. What was most important, which your newscast seemed to miss entirely, is the fact that too many Jamaicans don't know their health status, and as a consequence, only find out when they collapse with a stroke or a heart attack and end up at the accident and emergency ward. And the substance of the program was to highlight the importance of screening. And that was a comment that I made, and I stand by it. But nevertheless, as I said, that's your right to highlight the points that may be important or not so important.
But help us to understand, though, Dr. Tufton, because the initiative aimed to conduct 500,000 screenings, right?
Yes.
And you didn't meet that target. So help us to understand then, what were the primary challenges in meeting this target, which you had initially set out to accomplish?
I can, but I don't want to spend too much time on it, but I'd rather, again, focus on the substantive issues. But the targets were set based on a forecasting by the technocrats and the implementers of the program. Clearly, I turn up, I support, I advocate the policy, but on the ground, it's a function of the regional health authorities. There are several issues. I mean, there's the issues around just organizing the logistics of implementation. There are each activation we learn and we improve on. So there are issues in the survey, for example, around people feeling that maybe because of the masses that turn out, They may not have the confidentiality which we normally guarantee when it relates to health records, which is something that we have to guarantee because there are so many people. There are people who felt that they were waiting too long to get through, so they left and did not do the screening, and therefore were not captured in the data. Some of these activations in the town centers saw hundreds, thousands of people turning up, and if they were waiting beyond a certain point, they would decide not to exercise the opportunity that's available themselves. So as we went along, we had to tweak, we had to adjust, we had to expand in some areas in terms of the confidentiality, particularly around certain types of tests like HIV, syphilis, and so on. We had to locate the mobile clinic in a particular location. So there are many reasons for it. What I think is most important, however, is the fact that well over a third of our population, based on what I would consider to be a fairly representative sample, having screened or conducted over 220,000 screenings, are unaware of their condition, and their condition includes abnormalities in their health status. And that, to me, is the substantive issue which, as a country, we need to highlight as we seek to improve access to health screening, which the primary healthcare system, health centers across the country are primarily responsible for. And I think that's where the substantive conversations, if I may say so respectfully, should really take place if we want to do a civic duty to the population, who, frankly speaking, is a sick population based on the health profile, and try to help them to understand why they need to get screened as part of protecting themselves.
I don't want to stay on this issue for too long, Dr. Tufton, but isn't the fact that we missed a target that we were striving for, as you said, know your numbers, doesn't that in and of itself highlight the fact that many Jamaicans are either unwilling or just simply not in the proper mindset to know those numbers, just by the fact that we have missed that target?
Not necessarily, but that's the whole objective of having the program. The program is to reach people in their communities, in their locations, rather than them coming to a fixed location, a health center more often than not, or to their private doctors. So we go into the town squares where people are doing their shopping, and we say, listen, just set aside a half an hour and know your numbers. And then they find out that their blood pressure is well out of whack, and they have to be referred immediately to their doctor, in some cases even to the hospital. Or they find that they have other ailments. Their blood sugar, cholesterol levels are well out. And we found several of those, in fact, too many of those. And from that perspective, the program is an extremely valuable program, because what we're actually trying to do is to change the culture or the belief that you only go to the doctor when you are sick, as most people tend to do, particularly our men. And the program was built around that, and the narrative that we tried to project around public education, call to action, and of course execution was to encourage more people to take advantage of the opportunity for knowing their numbers. So I agree that too many people don't. The objective of the program is to encourage more people to. So that's really a big part of it. The other part of it, of course, is the revelations coming out of the screening and the data that we have collected, which is that too many people, having not known, are well out of whack, which is manifested in premature mortality, which we have spoken about, manifested in early onset of illnesses, which we have spoken about. I don't know if I had mentioned it here, but more people are dying before 75 years, which is the average life expectancy in Jamaica, than ever before. And more people are getting ill in early stages of their lives, from school all the way through to the workplace, than ever before. And a lot of that is a function of consumption habits, lack of exercise, rest, and I could go on. But a lot of it, too, is people not taking heed of the warning signs because they do not screen. And that's really what we're trying to get Jamaicans to do.
So in essence, then, In a sense, then,
Sorry.
Dr. Tufton, I would think then that both reporting would be, in fact, accurate because you're trying to get Jamaicans to come out to do and know their numbers, as you indicated, and you haven't gotten that number that you wanted. But also, based on those who came out to screen for the screening, you recognize that you have a much bigger problem. So, in a sense, then, how is the ministry working to educate and encourage more Jamaicans, particularly men, to take part in regular health screenings?
Well, the program will continue, but I think the more fundamental approach is, and I spoke to it in the Parliament, that also wasn't captured, was the need to, the reforming of our primary healthcare system, which has can be described as a sort of lifestyle approach, which will ultimately adopt automatic screening once a Jamaican goes to a health center. So unlike now where you go there for a particular purpose to be addressed, once you come in, the idea is to do screening and to outline to you what your numbers are. And I think that will catch a large portion of the population. We have about 1.6 million visits to our health centers each year on average, not people, but visits, so many of them repeat themselves. Beyond that, it is also about how we introduce more regular outreach in the communities. The concept of the mobile health center is going to be the way of the future, and that is to take the screening into communities. The concept of getting endorsements from influencers, because there's a gender disparity, particularly for men, getting our men to screen, whether using the women who are part of that family structure or using the pastor in the church or the JP or whatever else. That is part of the assessment as to how do we influence our men who are very underrepresented, even though the population disparity between male and female are almost equal, male-female gender ratio. So there are, I listed about 4 or 5 things that we're doing, and the opposition, as it is their right, interrogated a number of those. And we had a good discussion, and hopefully out of those discussions too will come better public awareness and education about the importance of screening.
And that matter of the gender disparity, Minister, is where I would like to take it next, because it's not just a matter of Jamaicans not knowing their numbers. It seems quite clear Jamaican men don't know their numbers for the most part. How do we now tackle that specifically? Beyond the suggestion I saw you put in Parliament where you called on the women to retract certain services in order to get the men to go out. But how do we realistically tackle this problem?
Yeah, it was a comical moment, and everybody was enjoying themselves. But the more substantive point, which I went on to make, was that our women do have a fair bit of influence over men, to the extent that the men have a woman in their lives. Now, whether it's their daughters or their mothers or their wives or partners, and women do take, for the most part, better care of themselves, certainly as it relates to going to the doctor. And so I was making a point that one of the key influencers would be the women, and we should target women to encourage their men so to do. But beyond that, though, the workplace is a very substantial contributor to lifestyle and wellness. I mean, at the end of the day, you spend a lot of time in your work environment. There is a workplace wellness policy. Too many employers do not sufficiently consider the health and wellness of their staff, who by the way, does have significant impact on their productivity. And what we're finding is that not enough is being done to promote a wellness culture within organizations. So we have a policy, a wellness workplace wellness policy, and we are developing an approach to push that workplace wellness policy. And then I made a point, having been quizzed by the opposition, that one of the most fundamental programs, I think anyway, that is likely to change lifestyle, because it's all about lifestyle, is the school nutrition policy, which has been in the making for some time. Lots of consultations have taken place. The Minister of Education, the current one, the one before, and I have been doing that. And we have a joint submission for Cabinet, which hopefully, given all the discussions, will lead to a policy that will see the school environment being sanitized of certain types of unhealthy lifestyle. I mean, the daily dose of the sweets, the salts, the deep fried creates a habit over time, which leads to unhealthy sickness. And we need to start early where habits can develop. So that, to me, is a potentially game-changing initiative, and that will be out soon, hopefully. And there's a plan that's going to be built out around that. There are other things too, the tobacco and the alcohol policy and all those things. It would take a program to go through all. But we're going to have to use policy to nudge, to encourage, and indeed to enforce more health-seeking behavior.
Mm-hmm.
And where are we? Go ahead, Sanjay.
Yeah, and also from an incentive perspective, Dr. Tufton, are there any plans to introduce incentives or partnerships with private healthcare providers to boost the participation?
Well, the workplace wellness is a policy with some very specific recommendations. So in a sense, we have done the work for the private sector, or the public actually, to look at following those protocols. And a lot of effort and resources went into that. Beyond that, though, the ability of the regions to dispatch a person within a company that may have an interest is possible. We do have the nutritionists, we do have the physical activity persons, and so on, and they can go in if so required. Beyond that, too, the concept of controlling conditions through medication or otherwise is a very fundamental right that is available through the National Health Fund, through the very health centers. One of the things that the Know Your Numbers program does is having exposed persons to the test. The final point is consultations with a doctor. And the doctor sits with them, reviews the numbers, and say, listen, your pressure is out of ordinary. You need to cut back on the alcohol. You need to do this. You need to do that. Or you need to follow up with your physician, whether private or public. That kind of advice is always available. And indeed, I think we take it for granted because it's not as available in many countries, so some even developed countries. And what we want to do is to make it a routine for people to access those opportunities for their own benefit.
And finally, for me, Dr. Tufton, as you pointed out, it's necessary to get our children into healthy lifestyle behavior choices before they become stuck in their ways, so to speak. And where are we in terms of getting that school nutrition policy out the door? Because I know we've been talking about it for quite a while now.
It went through a series of, it was a green paper, white paper, the policy has a process. But it's now at Cabinet, and that means a lot of work has gone into this point. Because we had to do a lot of consultation with parents, with the cafeteria operators, and with children and all that. So I think we have gone a long journey, but we're close. Beyond that, though, remember there are other things in the schools now that are taking place. We did introduce the policy around sugary drink restrictions to reduce the sugar content in juices, added sugars, that is, to 2.5 grams of sugar per 100 ml. When we started that program, there were sugary drinks in schools at 15 and 17 grams of sugar per 100 ml. And that just made the kids wildly active and then a very downward slope and sleepy. And it affected their learning. I mean, it's clinically proven. We're pushing a lot more water consumption. So many of the schools have the water days, which is good. The Jamaica Moves in Schools is also active and is taking place. So, things are happening. The wellness bench and the concept of safe space and safe person around mental health. We've trained a lot of teachers in that regard. And all of that really comes down to wellness. And we have done a lot, but there's always a lot more to do because the distractions are many. And today's environment is very different from certainly when I was growing up. You are young people, so maybe not for you, but for me.
That is Health Minister Dr. Christopher Tufton. Thank you for joining us, sir.
Mr. Shiz, all the best.
All the best to you as well.